Hello and welcome to the Oral Health channel. I'm your friendly neighborhood dentist, Dr. Rudra Mohan, and today we're going to be talking about aphthous ulcers in the mouth. So let's start. So today we're going to be talking about a special kind of ulcer that which happens very frequently in a lot of mouths, in a lot of people, irrespective of their age or gender, and this is known as an aphthous ulcer or a canker sore. This is typically seen as a painful ulcer, which is basically a white, yellowish or whitish area with a central area which is clear and a erythematous halo around it. So what you need to understand is this is very common. It generally happens with a lot of causes, which is very treatable. So how it happens is that generally it happens when you are stressed out. Any sort of psychological stress that maybe is challenging you for a long time, or you've been having sleep disturbances for a long time, or in the habit of taking too much stress, it might get aggravated and you would get an aphthous ulcer. Now what you need to understand about this is it is usually self-treatable, in the sense it goes away within 7 to 10 days. However, it can produce a lot of discomfort for you to speak or eat or drink or at the same time consume anything. So what you need to understand is, the basic thing is that you need to be assured that it will go away. Try to make sure that your stress is managed, and at the same time make sure that you don't take anything in the diet that can cause it to be aggravated, such as any acidic beverage, any spicy food, or anything in the diet that can cause harm to that already harmed area. Also, it is seen sometimes as a seasonal change. This might happen a lot. What you need to be very careful about is the fact that if at all it is happening way too much and way too cyclically. By cyclically, I mean it is happening way too frequently. The kind of distribution of the ulcers is basically very specific in one area of the mouth, and it has been happening for a long period of time. Also, if you're getting other symptoms such as weakness, fatigue or malaise, you might want to get a blood workup done and get yourself checked by a doctor, or a dentist rather, a medical practitioner, and just get yourself evaluated. Maybe you might require some intervention if the blood parameters are off. Also, what you need to understand to handle the symptoms are very typically a burning sensation which can get aggravated by even talking. So what you need to understand is that despite the fact that it goes on its own within 7 to 10 days, you have to be sure that you don't take anything too aggressive or too spicy. Make sure that you have a history of any change in your toothpaste, or at the same time if you've consumed any new sort of condiment in the form of supari or any spice. Also, if the symptoms are too much, you might want to use a topical anesthetic gel. I'm not going to name a brand or anything, but you need to understand it can help the process of eating in making yourself comfortable till the time you're eating your food. Please take a lot of fluids at this point of time, and make sure that you need to understand one thing very important. It is related to stress in the body, and it is definitely related to any sort of malnutrition. So at this point of time, you need to have a very good balanced diet and make sure that you are healthy mentally and physically all at the same time. If you really have some stress, please talk to someone about it, and if you feel that it is getting overwhelming, you can go and consult a professional regarding the same. These ulcers happen way frequently to a lot of people, but a lot of people sometimes, because of their phobia of cancer, think it's cancer. No, it's not cancer. You just have to wait it out for about 7 to 10 days and probably take some topical gel if the symptoms are too much, and within a few days it goes off. If in case it doesn't go off or it doesn't resolve on its own, you might want to really consider taking a professional medical opinion about the same. So this is all about aphthous ulcers in the mouth, and I hope you understand what I'm trying to convey here. Don't get alarmed by it's an ulcer, so it has to be something related to maybe cancer or something. Just speak to your registered medical practitioner or dentist and just follow their instructions. So that's it for today. Please leave your comments and feedback and help us grow. Thank you. Jai Hind.